I think I have a typical fever, rash, and joint pains. Maybe I'm having chikungunya. But which test to do and which one to do when? So, hello friends, I'm Dr. Piyush Chaudhari, getting to you the next video on the YouTube channel of Fever Care Center for Infectious Diseases. In this video, we are going to discuss how to diagnose chikungunya infection. So, as we saw in our previous video, the typical symptoms of chikungunya are abrupt onset fever, severe and very debilitating joint pain, and a typical rash which develops somewhere around day 2 to day 3 after the onset of fever. So anybody who has this typical triad, predominantly the fever and arthritis, and if such a person is residing in an area where other cases of chikungunya have been recently detected, or such a person has traveled to a place where chikungunya has been endemic within last 15 days, if the person has gone to such a place, then chikungunya infection should be suspected in that person. Now, because the systemic abnormalities or blood parameter related abnormalities like drop in white cells, drop in platelets is not very common in chikungunya, those things don't really help in reaching to any conclusion as to whether a person has chikungunya or not. So what are the tests? Basically, this is a viral infection. So even culture tests, which we routinely use to diagnose various bacterial infection, they are not of much use when it comes to chikungunya, because viral cultures like chikungunya viral isolation can be done only in biosafety level 3 and beyond research laboratories, and because of the cumbersome methods and extremely costly infrastructure needed, and the most important, the duration required, they are of no use for routine clinical practice. What is important are three types of tests. Chikungunya RT-PCR, so reverse transcription polymerase chain reaction, which detects the chikungunya virus in whole blood or serum of a person having this infection, or chikungunya IgM. So these are the antibodies which our body generates against the chikungunya virus after around 5 to 7 days or beyond from the onset of symptoms, or chikungunya IgG, which are relatively longer lasting or chronic antibodies which are produced after in a few weeks time from the infection and may remain detectable for several months or sometimes even up to few years. These are the three tests which can be used for diagnosis of chikungunya. Now, like we discussed in our last video, the chikungunya virus is typically detectable in a person's blood for up to 7 days after the symptom onset, meaning the RT-PCR based test for chikungunya virus should be utilized only up to first 7 days after the symptom onset, beyond which it is of not much use when it comes to diagnosing chikungunya. Also, like we discussed in various other infections, antibodies take time to develop. So even IgM antibodies against chikungunya virus, they also develop somewhere beyond 7 days, or sometime in a small percentage of patients even after few weeks. So IgM against chikungunya virus by ELISA method should be used for diagnosis only from second week onwards. Sometimes if the IgM titer in second week is quite low or almost not detectable, then repeating the titer after 3 to 4 weeks and demonstrating a four-fold rise in titer can also be considered as diagnostic of chikungunya infection. This is particularly important in the patients who present in the subacute phase of illness, that is between 3 weeks to 3 months, like we discussed in our previous video related to symptoms of chikungunya. Again, in patients who present directly in chronic phase, so with an illness very similar to rheumatoid arthritis or with post chikungunya chronic inflammatory rheumatism like symptom, in them neither PCR nor at times IgM is going to help in diagnosis. In such patients, IgG antibodies against chikungunya virus with a relevant clinical picture and background history of a viral illness or a chikungunya like illness 3 months or 6 months prior may help in labeling that person as to having post chikungunya arthralgia or the chronic phase of chikungunya infection. So to summarize, chikungunya RT-PCR direct viral detection from whole blood or serum in first 7 days. Chikungunya IgM either clear positive or a rising titer up to 2 weeks to 4 weeks from the onset of symptoms, and chikungunya IgM with IgG in chronic phases of chikungunya. These are the only three tests which can help us in routine clinical practice in diagnosing chikungunya in a person who has relevant clinical symptoms coming from an area where there have been cases of chikungunya reported in recent times. Other than these three, there are no other blood tests which can potentially help us in confirming the diagnosis of chikungunya infection. In the subsequent video, friends, on our channel of Fever Care Center for Infectious Diseases, we shall be discussing about treatment of chikungunya, which is the most important part after knowing that somebody has got chikungunya. Also, we will be discussing the treatment in patients who are having chikungunya related joint pains several months or even years after having got chikungunya in the past. So please don't forget to like, share and subscribe to the YouTube channel of Fever Care Center for Infectious Diseases. I'll see you again in the next video. Till then, remember, stay informed, stay healthy.